Anybody doing an in vitro fertilization cycle will be honest if they tell you that it gets to a certain point where it wears you out. It's like you can't even imagine taking one more shot. You can't imagine waking up one more day feeling like you do, as if you just want to die. The emotions are just ridiculous. The Lupron is still making your eyes blurry. You feel like crap. Yesterday, I kind of reached that point. I was just so tired of the process and just so ready for it to be over. And I'm really to the point where if this cycle doesn't work, I don't even know how I'm going to deal with it. Right now I'm feeling very lethargic. I've been having Lupron headaches, and I'm just tired. I'm so very tired. Okay, that's pretty much all I had to say at this intro. I have a little video here of my doctor's appointment from this morning. We had some good news as far as, we got, seems like about 8 measurable follicles currently, and Dr. Sacks is going to talk to you more about what that means in the video. I really hope you guys appreciate how huge this is that he allows me to bring a camera in and talk to him. And if you are in the DC metro area and you're looking for a really good doctor, I can't say enough about how great this guy is. So, okay, check out my appointment from today. I'm really sorry I'm not in a better mood, but I'm just really not there today.
The lining measures 9 millimeters, so we're looking over at the lining of the uterus right here.
Excellent.
And it's much thicker than it was the first time we looked a few days ago, because the medications have increased your estrogen level, and the estrogen's making the lining of the uterus grow nice and thick.
All right.
Now we can look over at the right ovary, and when you look over at the right ovary, last time we looked we didn't see much, and now we see these developing follicles. And on the right we have a 15, and each one of these follicles presumably will contain an egg. 14, and that's what our goal is at egg retrieval, is to try to recover those eggs. 13, and then we've got 2 more at the bottom of the ovary here. We have a 13 and an 11. So that right ovary is producing very well. We'll switch around and go look over at the left ovary, and you can see the left ovary right here. And we've got a few more follicles over there. 13.
Oh, looking good.
Right. And we've got 12. So they're still a little bit early. They'll need to grow to about 18 to 20 millimeters.
Okay.
11. And they grow at about 2 millimeters a day. So it will be a few more days of stimulation. You can also see that the ovaries are in good position. And let me go over that with you. In that here's the upper part of the vagina, and here's the ovaries. So when we do the retrieval, the needle goes right in to the ovary and doesn't really have anything in between, like any bowel or any blood vessels. So that's what makes the retrieval simple and with relatively low risk. So everything's moving along well. I'll take
I went out and I heard a lot of people talking about that book, The Infertility Diet, and I just wanted to know, did you have any thoughts on the types of diets that they're talking about and stuff like that?
Yeah, it's I read the book, and it's always difficult because you're going to find whenever there's an issue of diet, a lot of different views on it. What I think is the best is for anyone that's going through any type of medical procedures to have a well-balanced diet, trying to watch their caloric intake along with good intake of proteins, minimal carbs, and minimal fat. And I think overall, whether you're trying to get pregnant or not, that's still the best healthy approach.
And what if you're overweight? Should you really focus on trying to lose weight before starting this process?
That's probably the most difficult question to answer because we know that obesity does reduce fertility and also increase the risk of miscarriage. We also know that reduction of 10% of one's body weight brings them great benefits in terms of the success of the procedure as well as reduced risk of miscarriage. So when I'm meeting with a patient who is either overweight or obese, I bring this up to them. Now for some people, they have the time to focus on that. For other people, there may be constraints where they don't have the time, and so we try to work concomitantly where they go on a healthier lifestyle as well as go forward with their fertility procedures at the same time.
And that pretty much would work with anybody. I mean, just to eat healthy. And like, I know one of the things that scares me is all this stuff that I hear about stress.
Sure.
And, I'm kind of high strung, I guess. So what do you think about that?
Well, certainly the evidence out there shows that stress doesn't cause infertility. But on the other hand, when you look at the entire individual, anyone that can reduce their stress is going to be good. That reduction in stress will be good for their heart, it'll be good for their mental health, and so I always encourage people to do whatever they can to reduce their stress, but I don't want to make them feel that their stress, on the other hand, is leading to their infertility or will reduce the chances of success.
So do you guys have any programs here that look into Eastern medicine, acupuncture, anything like that?
Absolutely. We work with several acupuncturists around town. I would encourage my patients who feel comfortable going with acupuncture to do that as an adjunct. And we have a very flexible schedule in terms of if a person wants to have acupuncture done on the day of their retrieval or the day of their embryo transfer, we're very easy at working with them in terms of trying to schedule their procedure around their acupuncture treatment.
That's good to know. I know I tried it, and it just seemed to be a hassle with the driving back and forth, but I think I'm going to do it again this time.
Sure.
Now I have one other question.
Mm-hmm.
Wine. Now,
Sure.
I love a glass of wine with my dinner, and you read so much information. I promise you, I probably own every single book on infertility out there. Some say no wine, some say a little is fine. What do you say? Can I have a glass of wine with dinner?
Well, certainly when you're pregnant, wine has been shown to cause problems in fetal brain development. But there's absolutely no evidence to show that wine prior to pregnancy causes any issues. It clearly does not interact with our treatments. And so I would tell my patients that it's okay to have a glass of wine with dinner up until the time that we transfer the embryos back into the uterus.
Excellent. Well, thank you again. You got big plans for the weekend?
Big plans for the weekend.
Sunday?
Right. The rest of the weekend, just take it easy and see you back on Monday morning.
Wonderful.
Okay.
Thank you.
Thanks, Monica.
So now I'm off to figure out what I'm going to do for the rest of the day. I woke up pretty early to get here, and can't say that I'm not all that cranky. But oddly, I don't feel like going home and resting. Wonder what I can get into.